Hello, this is Paul Barr for Hospitals and Health Networks. Today I'm speaking with Donna King, Vice President of Clinical Operations and Chief Nurse Executive for Advocate Illinois Masonic Medical Center in Chicago. Donna was part of a team that has figured out ways to maximize its use of providers, mainly advanced practice nurses, physician assistants, and physicians. Thanks for being here today, Donna.
Thank you.
What was the driver behind Advocate's decision to adopt an advanced practice clinician strategy?
There were several drivers, Paul. I think most important, as we looked at population health, we wanted to change our care model in order to be able to embrace that and be able to serve our communities. Secondly, as many of us were interviewing and mentoring, coaching young people into nursing, we found their questions were really related around the advanced practice role. In addition, when they graduated and were coming into our RN residencies, they were asking about the advanced practice role more specifically and automatically moving into those programs. Clearly, we started to discuss that these nurses are not totally prepared for that role, and we needed to get our arms around that too. So there were two: ensuring that we could assist and manage a quality enterprise for the future that was cost effective, and two, ensuring that the advanced practice clinicians were competent and confident in their role.
Were doctors very receptive to the changes you introduced?
You know, it's interesting. There was several opinions on that and concerns, and yet a lot of enthusiasm. And I think it really was based into the knowledge deficit about what can an advanced practice clinician do. So we have advanced practice nurses, and then we also have a physician assistants. Physician assistants were very familiar to the physician because it is a medical model, but the advanced practice nurse was a little less clear. It even was sometimes not clear for our own nursing colleagues. And so there was a lot of education, but there are a lot of breakthroughs when they realized how this could leverage their practice and help to make them more efficient and successful in delivering patient care.
What did you learn during the process? Anything?
There were numerous things. One, that we had such a variety of practices across the system, and we needed to focus on standardizing our infrastructure and our protocols so that we were efficient. And we also learned that it takes a lot of patience to take the time to educate people on what this role is and how it can help us in the future. And really, how does it improve the patient experience?
Do you have any advice for a hospital or health system looking to implement this kind of strategy?
As with many strategies, having all the key stakeholders present is critical. Taking the time to listen to the concerns of your medical staff will surface any of the concerns that they have about education and how this role can help them. More importantly, you have to do the due diligence on your own protocols and policies, because those are the ones you want to standardize, whether it is your medical staff a credentialing process and privileging, so that that is standardized and you are getting privileges that really reflect the competencies of these clinicians, or whether it's how you're doing your competency assessment. So take the time to do your due diligence and your inventory and move forward, because it is really the way for the future.
Thank you very much. That was very interesting.
Thank you, Paul.
For Hospitals and Health Networks magazine, this is Paul Barr. Thanks for watching.